We go now to Tom Wyatt, the CEO of KinderCare, a company that operates about 1,500 childcare and early childhood education facilities in 40 states. He joins us from Seattle, Washington. Good morning to you.
Good morning, Margaret.
I want to ask you about some of the lessons you've learned, but just right off the bat, I see that there have been reports of clusters of COVID cases in some child care centers in Charlotte, North Carolina just this week. Out west as well, there have been some. How does KinderCare handle outbreaks like this, and how many have you seen in your facilities?
We've seen a few. What we do, let me take you through the health and safety process. We keep children in one pod. We keep them in one classroom. We feel that that's very important because we don't want to have people be exposed to different people, different teachers, what have you. So we keep them in pods, and by doing so, we have two forms of, if you will, generation or transmissions. One is if we have one case in a center, we'll close that center for 72 hours. We will disinfect it, then we will reopen it. If, in fact, we have more cases than that, we will actually close the center for 14 days. We have closed in the last 3 months. We've closed about 70 of our centers for 14 days, and we have closed 120 of them for 72 hours. And we feel like that means that our process is working, our protocols are working, which we work very closely with the CDC, and candidly, we are above what their requirements are because we actually feel very strongly that we're taking care of the most precious asset a family has.
I'm sure every parent would agree with you in that. But specifically, what does that mean? What kind of protections are you giving your staff? Are you testing them? And if so, how regularly? And is there any data that you have that shows that kids are spreading it or not spreading COVID?
We have no data to say they're spreading or not spreading it. As far as what we do, all of our teachers wear masks. All of our teachers that are in states that are offering essential workers testing, we encourage them to do so. We actually gave shields to our newborn and infant teachers because we wanted the children to actually see the expressions of their teachers because they connect that way. We do a temperature check every time a child comes to the center every single day. We also have a questionnaire for the families to fill out. We don't let families take their children back to the room. We actually have a teacher that will come from that pod to escort the child back to that room. As I said, the children stay together. We sanitize the playground equipment, every single pod that comes in. And when the children take naps during the day, we actually position them in a way that they're actually 6 feet apart. So all in the preservation of health and safety.
So McKinsey says about 27 million workers, 16% of the workforce is dependent on childcare in order for them to do their own jobs. But we know there are lower income workers who have frontline jobs, and it's difficult to afford childcare. Even at a facility like you're saying, you are trying to keep open.
Right.
What is the solution to this, since it is part of reopening the economy? When you talk to people in Washington, are you suggesting that Congress provide subsidies to childcare? I mean, the federal government doesn't do that for early childhood education.
Very, very good question. Let me tell you a couple of things that we are in conversations with Congress on, and we feel like we'll be a part of, we hope, will be a part of phase 4 when they return on the 20th of July from recess. Two things that we've asked them for is we are operating at a compromised state. State mandates have been a certain number of children in a room, much less than we've had in the past. Our centers, given those mandates, can only get to 45, 50% of their capacity, which candidly, we don't make money at that rate. So we need to relax those over time and when it's safe to do so. So we've asked for a rebound grant fund, and that fund is for the next 6 to 9 months. We're asking for between $25 and $50 billion to help us get through the additional cost of PPE, the additional cost of training. We have more labor in the center than we had pre-COVID. We have a dedicated ambassador for health and safety, which is an additional headcount. and all of that with less than 50% of the children that we had pre-COVID.
Well,
So that's one. Forgive
Yep.
me, I didn't answer your question.
Well, I'm sorry, I have to leave it there, but we will be tracking what happens with you and childcare on this program ahead. Thank you for sharing your insights, Tom Wyatt.